This is a Tedoex Media House production.
So, Munya, you have started this Textaid for coronavirus tracking. Could you simplify the technology for us and explain exactly how you guys are doing this work?
Yeah, so Textaid is very exciting. It's actually a lot older than it looks or that people think. I started it just over 2 years ago to work or focus on managed health for people with chronic conditions. The idea that kind of managing and monitoring behavior and being able to assist with that was going to be more effective than obviously treating people that have exogenous shocks to their health was the initial kind of theory behind why we built a text platform to be able to talk to people about their health regularly. And then we ran a very successful pilot of that particular technology in Zim late last year, which gave us enough evidence to believe that we had something that could really help the society and also remove a number of barriers to entry. It's not an app. It's not something that requires money or data to download. It's very accessible and provides key information. So those are kind of the hypotheses we were trying to prove. And then came COVID-19, and it just dawned on me, I think, one day that maybe we could manipulate the platform to be able to create a use case that can help people to self-report, first of all, because the government was having a number of struggles around identifying potential carriers, getting those people to be identified, assessed, tested, and then isolated for a period of time. So we went about kind of going into the back end of our Flow platform, which is the system that actually structures the messages together to see whether or not we could introduce menu items related to self-reporting. That was quite easy. And of course context tracing, and then we went into the back end to figure out that if we could collect or harvest this information at an individual person perspective, could we put two and two together and make five from a data play perspective, give the government advantages by identifying aggregated clusters, by finding use cases that they wouldn't be intuitively thinking about, but the data would be telling a particularly innovative or interesting story. So that actually didn't take us that long. It was about 3 weeks of sleepless nights of beating the platform around until it gave us a use case that worked. And then I was invited to present that to the chief principal directors at the Ministry of Health, and they had a lot of people pitching ideas at that time. The Harare Institute of Technology was doing it. UNICEF was building something, and they were like, "Well, first to cross the finish line can have it. Go away and try it." But we actually decided among us that were working on these projects not to compete, but to work together to be able to leverage each other's bits of technology, to learn from each other what we've been building, and to try and come out with like a really useful and kind of Pareto efficient system rather than kind of these single point solutions that don't speak to each other from a data perspective.
Oh, okay. So, in your team, so you're based in the UK. Who is your team, and what are their backgrounds?
So my co-founder, Amos, he's also based here in London. He's a software engineer, first class computer science grad, super sharp guy, got a big brain. I've got Rati, who sits in Johannesburg. She's got a master's in human-centered design for medical innovation. She was actually doing her PhD on the same in Canada, but took a break to go and help a startup out down there that actually also works in the mobile health space. So she's kind of our operational genius that joins the dots between what we're building technically and how it affects humans from a health perspective, and kind of keeps us honest to the efficacy of our tool set. Then we've got Zika, who's based in Zambia. He's essentially our head of data and architecture. He gets all the data to speak to each other. He's got a master's in civil engineering from Exeter University, and he's basically all about how do I ask the data questions and how do I get to tell a certain kind of story and narrative that's easy for our client to understand. So that's the very small team at this point in time.
So you did get to show me a little bit about how it works, but for the general public, how do they access Textaid, and then how does one go about reporting, and then where does the data go to?
Great question. So Textaid, you simply have to text reg, R-E-G, to 2019. At that point, you will be welcomed into what we call a flow. And then that flow will interrogate whether you want to continue that discussion in WhatsApp or via SMS. It will attempt to recruit you through a registration process initially, kind of ask you some pretty fundamental kind of demographic questions, when were you born, gender, that language, that kind of thing. And then it will then begin to assess you for symptoms. It'll do what we call a symptom checker, which is graduating you from the registration flow to a flow that asks questions about kind of related to the WHO guidelines on symptoms. And once it takes you through that, it says, okay, it goes back and calls its infection propensity model and says, this person has these symptoms. And based on this, I think that I should send them to the contact trace flow, which then says, can we talk a little bit about where you've been, who you've seen lately, and kind of the concentration of those people. And then what it also does is that it takes you through what we call a travel or recently traveled checker as well, which looks at where you've been and how recent that travel was. Because I think I might have mentioned to you in a previous discussion that a large majority of the positive tests that we've had have been asymptomatic, but have actually had positive markers for travel. So eventually, those symptoms do emerge, but the initial indicator or the leading indicator that we're relying on at the moment is our quality of travel, previously traveled data. And so the system then takes you through this flow, and then once that's done, it thanks you for your kind of participation, and then says, look, I'll check on you every now and again and give you advice based on whether or not we think you're somebody that's been exposed or symptomatic or likely to develop symptoms of COVID-19.
Well, since you guys are doing this pilot run in Zimbabwe, does somebody need to have airtime to?
No.
Okay.
You don't need to have airtime. We worked with the mobile network operators to make the short code 2019 free for most users, I think. So I think we've got about 99% coverage. There will be an odd edge case here and there, but in general, you don't need airtime in order to be able to actually have the SMS dialogue with the system.
That's pretty cool. And it makes it really accessible for everybody, so long as they have a phone. So how many registered users do you guys currently have so far?
As it stands, and I'm just going to pull this up on our dashboard. It's really exciting actually, because this is, again, it hasn't been officially promoted yet to the public in detail, because the Ministry of Health does go through quite an extensive process of validation and checking. And we've just finished and concluded the kind of this pilot phase where they feel satisfied that the data that we're giving them is actually impacting their resource allocation. It's giving them a layer of intelligence they've not had before. And on that basis, they're actually going to be going to market with it as a promoted service next week to the country. But in the intervening period, we've had just over 851 registered users, who are the ones that have been taken through the registration flow and given us their credentials. And then we've had 2,958 referred users, who are the people that are mentioned or as part of the contact tracing flow. They're the ones where somebody's like, yeah, I went to my grand's, I went to my friend, and I hung out with my sister, that kind of thing. So in total, we've got about 4,000 users that have now joined the system. And that's quite a steep climb since the last time that we spoke, I think. So it's quite exciting that that's happening kind of almost organically. Whereas as from next week, there's going to be the full power of the state behind it. The state-owned press, the radio, television, etc., discussing what people can do in order to be able to at least make sure that they're safe and that their loved ones are safe as well.
Are you seeing any sort of the organic growth? Is it mostly centralized around Harare, or it's mostly more spread out throughout the country?
Surprisingly, when I look at our bubbles of where the data is most concentrated, it's actually, Harare is not like the biggest bubble. The biggest one we have is actually in Mutare and surrounding areas in Mutare. And what we attribute that to probably is the fact that people have traveled recently and are on these border towns or near these border towns, and kind of the indicators there, were the leading indicators that people that come from South Africa in particular, where we get the large volume of people that are migrating home, while industries are shut down in our bordering neighbor, is that when they come home, they don't necessarily live in Harare. They live in Mutare, they live in Gweru, they live in Mashingo, etc. So from that perspective, no, Harare is not the biggest, which is kind of a surprise. But again, the data tells us that, which is a good news story.
And how did you get that initial word out?
So UNICEF had mentioned that they were working on a collaborative project with us, and they did a little bit of PR around it. And that's how that initial recruitment has happened. But it was very, 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 very thin from any kind of breadth perspective. And we expect to do much, much more than that. We're even recruiting some influencers to be able to register and self-report on the right channels and platform in order to encourage other people that look up to them, I suppose, to use the system in the same way.
So who does the data belong to, and where is it going to go?
So the data, this was a serious point of contention when we went in initially, because the initial concept or architecture around Textaid was originally built in Microsoft's Azure, and we built it for the cloud. We are in our data centers, or the nearest data centers Azure, are in South Africa, but the Ministry of Health just did not have levels of comfort and assurance that they would be in control, that data would be safe if it was sitting across the border, even if it's in a secure data infrastructure. So part of the challenge of launching this system was that we actually had to tear down our entire architecture and build the system on local government machines that we would then have to kind of key into from here. So I was building something on a machine in Harare inside the Ministry of Health's building that had limited time restricted access and security protocols for a period of time. And then all of the data that we're collecting and harvesting is stored on that machine in Harare, in the Ministry of Health's building, and they are essentially in possession of that to be able to manipulate it for the purposes that we've discussed. And I completely understand it. I mean, part of the symptoms checker is that you end up being able to stitch somebody's medical conditions with their phone number, and that's quite important data to just kind of be floating around. So, we had to sign quite strong service level agreements around the handling of that data. And perhaps even more importantly, in sprint 2 of what we're going to be launching with the government, we will be looking at pre-existing conditions and how to help people that might have other conditions where COVID is particularly nefarious, and ensure that we can give them the right advice. And again, you don't want somebody that's exposing their HIV status or their recent cancer treatment for that to be data that's held by essentially people like me.
Around data, I do have a question here, which is considering that from my understanding, you have people self-reporting, but then also it then leads to sort of referred users and information about their demographics, where they've been, who they might be related to, etc., things like that. Have you considered the ethics around surveillance, particularly in an African political context, whereby surveillance, seeing as how COVID-19 has been politicized as well, and whilst it is useful, absolutely such a useful platform for COVID-19 and contact tracing, have you considered the issues around the ethics of surveillance, how that data might be used, who might be at risk, and even after COVID-19, quote unquote, if there's ever a world that is post-COVID-19, how that data might be used for surveillance, even during, for example?
Yeah, Rutendo, that's an excellent question, and we did think long and hard about the ethical issues around surveillance, which is actually one of the reasons why we don't have a geolocation app on our system. We don't there's nothing on your phone that's related to us actually following you around kind of anonymously, and in the kind of conceptual sprint of Textaid in its current use case, we thought really carefully about, do we really want to have that kind of information, and do people understand what it means for there to be an anonymous geolocation tool set that's kind of pinging every network tower as you go about your business. And I think in particular in Zim, people would have levels of discomfort around that, so we shied away from all of that altogether. On your question about then referred users and the ethics around that particular issue, I think there is a fine balance there between really respecting the individual rights of people, and building a tool that can actually do something powerful in a pandemic system. So we took the view that while this pandemic system is in place, we're going to seek the right permissions from the user as part of this flow, and ask them those questions. They can decline to answer them if they don't want to, but recognizing that they are, we rely on the kind of quality of their responses to address a public health crisis. We didn't see any other way that was going to be accessible to everybody, and that was going to be able to almost grow organically in the way that it has done. And of course, there are very, very clear guidelines for how to use that data post the COVID use case at this point. So, I mean, there's a good level of trust between us and the Ministry of Health on this particular issue. As to whether technology like this in general could be used again for more nefarious purposes, yeah, I think that it can be manipulated if somebody was to be that ambitious.
For sure. You also mentioned that you were building this 2 years ago, right?
That's
And right now you had to change it and work on it to make it more, I guess, apt for COVID-19. Where do you see this technology come in and help build medical health practices in Zimbabwe? But we could say Africa, but like specifically in Zimbabwe, where do you see digital health come in? And where do companies such as yours fall in place? As you answer this question, could you also tell us about the challenges you're facing currently, trying to bring in more digital mobile health into the country and into the system?
Yeah. Really, really good question. My wish, or the initial kind of vision behind Textaid, was to address the idea of managed health, because the scourge of chronic conditions among our population has actually risen quite a bit over the last 30 years. It's the largest segment now of claims in any insurance, health insurance type scenario. But what has happened is that while we've become people that live, let's say in bunny ears, we live longer, but we're not as healthy as we used to be. We need more care for longer periods of time, especially as we kind of transfer into elderly life. Within that context, one starts to really consider, what can you do that means that we're on the preventative side rather than on the treatment side of a lot of these things. And for those that have chronic conditions, you can't really prevent it once it's occurred, but you can manage it much better than wait for an exogenous shock like a heart attack or something like that to cause you to change your behavior or live your life a better way. So my wish around managed health is that we introduce it as something very normal. That if your gran is in the village and she's on blood pressure medication, the next of kin is going to be notified that at meal times she should really take her medication. She's on a 30-day prescription, and as that runs out, all of you are notified that if she's been doing it properly, there should be no pills left in that bottle. But if it's full all the time, she's taken agency and autonomously decided that she only needs to take it twice a day, not 3 times a day, whatever it is. That's actually having a slow compounding effect on the quality of health of the patient over a period of time, and eventually you end up in hospital, which is a more expensive shock both to the household as well as to the insurance provider. So we wanted to address this challenge in particular, and have some behavioral intervention work go into predominantly chronic conditions, but then there are these seasonal conditions that occur as well. Things like pregnancy. What could we do if we could give first-time moms more information about how their body is changing, and information about how often they need to be checked, etc. So again, my wish is to enable the patient and the user with data that allows them to manage their condition better, regardless of what it is. But that's obviously on a spectrum. Today we're focused on chronic conditions. The next use case, which excites me probably the most right now, is the ability to offer discrete reporting via text, to just talk to a system that's anonymous, that can take you through a certain series of menu items. To me, is really, really powerful for social good. Right? Look at things like domestic or violence or child abuse. Growing up, there was loads of promotion of things like Childline. I don't know what services are available at the moment, but I see a world in which Textaid has a very important role to play in knowing who to text or what to text with respect to any kind of abuses that might be going on in a particular environment or household. And so the ability to introduce, again, a concierge that can help you to step through a series of questions that gives public health officials, the police, or whoever, enough information to know that that's an area we need to go and pay close attention to, or we might need to interrogate the members of that household is is something that motivates us as a team quite a bit. As to the challenges that we faced implementing the tool, I think there are three fundamental things that worry me about the approach that we took at this point in time. The first is that the understanding of big data and how it scales is something that's quite pedestrian at the moment within our government organizations. The fear of the cloud, as it were, and the powers that the cloud can give them, I think, border on irrationality to some extent. I don't know, maybe, I don't know, I'm yet to be convinced that a local machine sat inside the Ministry of Health is a more secure way to process patient data than, of course, putting it in triple checked Microsoft Azure data centers that might be across the board in Joburg. I need to actually know more about that. The other thing that's worrying is just the bureaucracy that you will face normally when you're dealing with government, because they have their protocols and processes. But where it really begins to concern me is when you're in a pandemic, right? In those scenarios, you do want to dot all the I's and cross all the T's, but also every day that you kind of spend moving sideways, the virus is progressing forward. So I just wish there was kind of more urgency around interventions from a government perspective with respect to pandemic outbreaks and that kind. And we have more than COVID that hits Zim at any given point in time. I think right now we're also battling a typhoid outbreak somewhere. We've got like a respiratory disease that's supposedly unrelated to COVID that's also breaking out, and then we've got malaria that continues to be a significant contributor to deaths, even though it's not a viral infection, whatever the case is. It's still something that they're grappling with because they take certain steps that I think if we shouldn't skip them, but we should make them more efficient, and those possibilities are there. The last one is just digital enablement of our public sector players. I really want to introduce them to more training just around advantages of not writing in your counter books, and kind of storing that unstructured data in inaccessible ways, but to just think intentionally about migrating towards infrastructure that is shareable, accessible from any location, a digital record, for example. And today we don't really have those advantages, which does worry. I wonder whether there is even a budget allocated for that kind of enablement. Yeah.
Do you think you could also use your platform to share generally public health information about the coronavirus or other outbreaks like typhoid, so that people can be more empowered and they know what to do and they have an understanding of what's really going on beyond just what they're seeing in the news?
100%. And again, in the original manifestation of Textaid, this was the idea, right? That managed health is about better information or timely information. And I think that Textaid has the opportunity to really change the quality of information that people have. Right now people have to read the tea leaves in order to get a sense of where they are, or there's loads of viral messages that go about it could be lemons or garlic that make it go away, you know what I mean? And really that departure from a scientific approach is worrying. At the same time, the scientific stuff that I've read is almost too cogitative and high level that it can get perplexing very, very quickly, and especially for people that don't speak English, which is not an insignificant proportion of our population. All of those things taken into consideration, there is a massive role to play for the distribution of key information, but that's distilled in digestible chunks for people to actually know, okay, that's dangerous or that's quite safe as a practice. And today we don't really have that.
I do like how you guys are using platforms like WhatsApp, which are more prevalent at home. Well, I think generally in the African continent, everyone mostly uses WhatsApp instead of just developing an app or using channels like Twitter. Are you guys able then to pivot to maybe using Facebook as well, since that's a really big platform?
Yeah, I think we could probably plug it into any messaging system in the world, given enough time. It's just about making the right choices based on you know, how many people have that Facebook if we do a kind of a quick scan of a demographic study. And the good news about Facebook, which I work with in my other job every day, is that they do make that data quite accessible. So if you did want to inspect, you know, what's my coverage or what's my level of utilization of Messenger, for example, in a place like Zoom, you'd be able to kind of access that information quite quickly. Rather than multiply the channels that we're distributing information on at the moment, we're more likely to think about how to use those channels more effectively as a first sprint. What other use cases can we spawn rather than kind of have a duplicity or multiplicity of channels? Because I just, you know, once you move out of WhatsApp or text, everything else costs the users money. And we've seen that as quite a significant kind of barrier to entry on the adherence landscape of medical information tools.
Okay, Munya, is there anything else that you wish we had asked you?
No. Are you going to talk about how you guys are going to make us information in all kinds of languages? Because you guys are so brainy.
I do have one question though.
Go for it.
If that's okay. Could you just expand on? You already mentioned the issue of, you know, language barrier as a potential to accessibility of the information, of the platform, and of the services.
Yeah.
Is there, you know, how do you see Textaid grow and address that? And also the other things that I'd like to include in accessibility would be things such as simplicity of information. That is to say, you know, for example, being in Zimbabwe right now, I have heard so much misinformation. For example, some people have said, one, it's only in returnees. Two, I've heard that the apostolic sect has been professed, I don't know what they do, prophetic things, that they are actually immune to it. The third thing is that the third normal thing that people are saying, not normal, but like that's all over the world, is about, you know, young people don't actually get it, and therefore we could go about our lives. So there's a lot of misinformation that is happening. And I think the issue of it is also just this information that is being passed is not simple enough for people to understand. For example, why wear a mask, why sanitize, why wash.
Yeah.
How do you guys see your platform work on that? For example, for people in the rural areas maybe that speak different languages, or, you know, or need to understand the science behind it, but in a more simplified manner. Do you guys see your role in that in any way, or are you just hoping that the more referred users there are, the more people actually use and trust the platform?
Yeah, it's a really good question, and it's something that I do worry about. I will say that I think when you're designing a product, you've got to kind of pick your battles, right?
Yeah.
Initially, we had nothing, so we had to use a very blunt instrument to be able to get the initial set of information out. But it didn't make any socio-economic considerations or even any cultural considerations in a good way initially. But it did give us the foundation to be able to evolve our understanding about African traditional religion, or religion itself, or kind of the nuance of language, or kind of the superstitious nature of our society. Now that we have an understanding of those things, or we continue to learn more about those things, we actually have a platform that we can bend and twist to be able to consider you know, how to address the seriousness of hand washing, face mask wearing, and self-isolating, for example, even if you haven't been identified formally, even if you just become somebody that's symptomatic. We want to go towards that, but we also know that we have a very specific role to play in the evolution of the platform, which is on the technical side, to make sure that it works all the time, it doesn't fall over, it's returning data back to the ministry. Right now we're doing it in it refreshes every 2 minutes, which for them is, you know, is a huge innovation. But it took us, you know, we went from 2 hours to 2 minutes over the course of the last kind of 2 weeks. And so we believe that as Textaid, where we're going to have kind of unfair advantages and quantum leaps of progress is to continue to evolve the technical strength of the platform and give it more horsepower. But we do want to partner with other people that can then kind of look at what we're doing and say, you know, if you considered the kind of socioeconomic environment in which you're introducing this tool, you would have much more profit for your effort if you considered, you know, ATR, or if you considered, you know, language, if you considered, etc. And we're really open to those types of partnerships, because again, we're not experts in that space, but we can make the container effective enough to be able to absorb that information and then distribute it in a good way. So hugely important, you know, aspect that you highlight. we won't be able to make much progress on that unless we get help and find really smart people that can help us.
That's really fair, actually. I think you got to what I was asking, which is, do you have room for partnerships with different organizations and different people, which would then be important for you to tell the audience where they can best find you or how they can get in touch with you as well.
Yeah. You can email me, Munya, at textaid.io, which is textaid.io. You can find me on Twitter. I sometimes hang out there. I don't talk much Textaid over there, but any route will work. I'm on It's Hoto on Twitter. That's ITS_HOT_O. So you can find me there as well. On there. But yeah, Textaid.io, the website is up. There's a contact form on there as well. You can go and kind of fiddle around and submit a request for information or interest on there as well. And yeah, would love to hear from as many people that have interesting ideas around content production, how to add to the platform, how to iteratively kind of make it better. Because again, this is a public good. We donated the platform at no cost to the government. We worked on it for months just to make it accessible to the public, and we'll continue to invite more people to play that part in helping the country move forward.
Okay, we're going to ask you a couple of rapid fire questions that have almost nothing to do with the pandemic.
Okay.
So just say the first thing that comes to mind.
Right.
What's something that's come about from the pandemic that's become part of your daily routine?
Oh, I watch the news a lot more than I ever have. I think I probably watched 3 or 4 hours of news cycles, just, I don't know, whether out of curiosity or out of fear. I don't know. So I never used to watch this much news.
And then in a perfect post-pandemic world, what is the first thing you will do, or where's the first place you're going to go?
Oh, good question. I'm going to take my wife to Italy. We've decided that having been in our house for 3 months, we want to go and live on the beach for about 2 months as soon as it's possible. So we're going to go find something on the Amalfi Coast and just wake up to the sea every day.
That sounds like a dream. And what is something that's come up that you hope we keep either as a society or for yourself?
One of the things that I genuinely like about what's happened is that it's put the responsibility of the betterment of society on individuals rather than on external groups that should, make sure that we're all safe or whatever. This is the first time that I've ever seen every single person be acquainted with a big problem that faces a society or on a local or macro level. And then they also know that they play an important part personally in making it better. And I wish it wasn't a pandemic that galvanized that kind of shared understanding. There was something else. But, the pandemic has shown us that everyone has a small part to play, even if your part is just to stay in your house, you can end up like saving a life or kind of flattening the curve, as it were. So I really hope that spirit of, of course, I might not be in control, but I'm responsible to some extent, is something that I would love to see manifest in more positive ways.
Well, thank you, Munya, for joining us on our platform, and this has been really informative.
Thank you very much for having me, guys.